I am pleased to present the preliminary findings of the COVID Impact Project on behalf of the team at the Bridge Engagement Center. My name is Sadia, and I am a PhD student at the Center and a team member of the COVID Impact Project. The following is a bird's-eye view of the project's preliminary findings, which I will delve into in the following slides. The pandemic has been challenging in general, and especially for the most vulnerable. The preliminary findings of the project show considerable job loss, drops in income, decline in self-reported health, and food insecurity. All of this in populations that are already living in poverty and experiencing multiple forms of disadvantage, with a particular disproportionate fallout of the pandemic on racialized populations. Vulnerable populations face numerous social and health inequities, posing daily challenges that are exacerbated during times of crises. Lessons learned from previous public health crises suggest that inappropriate communication strategies jeopardize risk reduction for vulnerable populations. The COVID Impact Project is a mixed method project with the objective of understanding the social, economic, and physical and mental health impacts of COVID-19 public health emergency response efforts and communication strategies on Ottawa's low-income, homeless, or at risk for homelessness and visible minority populations. The project includes up to 400 surveys, of which 134 surveys have been completed to date, which cover topics that range from physical and mental health of participants, the socioeconomic characteristics of participants, and the health and digital literacy skills of participants. A sample of participants will complete semi-structured interviews that further explore the experiences of vulnerable populations with physical distancing, exposure to public health messaging, and COVID-19 related misinformation. Another sample will complete a card sorting technique to co-design multimodal health messages. The card sorting technique will include the co-development of 40 health messages with participants using a variety of sources from various levels of government and modalities that include infographics and videos. Overall, the demographics of the project show about the same proportion of men and women and Black and white identifying participants. We are also seeing a growing proportion of Indigenous identifying participants. All of our participants have reported that they live on low incomes, are insecurely housed, or live in social housing, and are racialized and/or identify as people who use drugs. Many of the project participants reported receiving government pandemic supports, losing work, and experiencing unemployment. This was particularly evident in white identifying and Black identifying participants. It is important to note that our project participants were already living in poverty, and the loss of work would be much more devastating and detrimental relative to the general population. Many of the participants reported experiencing precarious housing, losing housing, and becoming homeless or being at risk for homelessness. We also learned that many of the participants worked essential frontline services, and in their work felt unsafe. We will be doing a deeper dive to understand the reasons that underpin this experience. Many also reported a significant decline in their general health status, a pattern that is maintained across gender and race. The decline in self-reported health is significant, with an average decrease of 6 points on the measure of self-reported health, comparing before the pandemic with during the pandemic. Lastly, many participants reported experiencing serious food insecurity during the pandemic, experiencing hunger more than 50% of the time. The results I present are alarming and demonstrate that the most vulnerable in our society are carrying the burden of this pandemic. The data collection continues and will include data on many other elements of people's lives, including their substance use, interaction with various systems in our society such as the healthcare and justice systems, and the understanding and use of public health messaging from various levels of government. Thank you, and please feel free to reach out if you have any questions regarding the project or would like to learn more.